In this video, I'm going to tell you about low diastolic blood pressure. If diastolic blood pressure gets too low, it can be just as dangerous as high blood pressure. This video will tell you how low is too low, its causes, symptoms, treatments, and the consequences if you don't correct it. If you want to see more blood pressure videos like this one, click the subscribe button and the bell icon. First, let me explain what diastolic blood pressure is. Of the two blood pressure numbers, diastolic is the lower number. If your blood pressure reading is 120/80, your diastolic blood pressure is 80. Diastolic blood pressure indicates how much pressure your blood is exerting against your artery walls when the heart is resting between beats. The blood pressure chart and guidelines doesn't have a category for low or low diastolic blood pressure. The guidelines doesn't give a clear-cut number for low blood pressure like it does for normal and high blood pressure. The lowest category on the chart, which is normal, states that normal diastolic blood pressure is less than 80. So if the American Heart Association and the American College of Cardiology have not indicated a number for low blood pressure, how do we? Well, what I can tell you is most of the medical experts say low diastolic blood pressure is less than 60. If your blood pressure gets too low, your organs are not supplied with the proper amounts of oxygen and nutrients. These organs include your brain and heart, and sometimes low blood pressure can become an emergency, which I'll explain a little later. But first, there are several causes of low diastolic blood pressure. Some causes are common and can occur with everyday activity, while others are not and can differ in severity. The following medications may cause low blood pressure: painkillers, antidepressants, and take a look at numbers 5 and 6. Heart medicine, particularly ones used for high blood pressure, and certain prescription and over-the-counter drugs when taken with high blood pressure medications. Other causes can be severe infection, heart problems, like those times when the heart can't pump enough blood, severe allergic reactions, a quick change in body position, like when standing up too fast. Another cause can be a decrease in blood volume, beginning stages of pregnancy, nutrition deficiencies, like lack of B12 and folic acid. Endocrine problems can cause low diastolic blood pressure, like Addison's disease, low blood sugar, diabetes, and thyroid problems. And the last cause is nerve damage with diabetes. Many times your blood pressure can become low and you may not even be aware of it. This is okay because typically low blood pressure is not an emergency. For some people, having low blood pressure may be normal, but if you have a sudden drop in blood pressure and it's accompanied by any of the following symptoms, it's considered an emergency: fainting, dizziness or lightheadedness, blurred vision, rapid breathing, fatigue, lack of concentration, cold, clammy skin, and dehydration. If you have low blood pressure and one of these symptoms, you should seek immediate medical attention. The experts suggest to call 911. This advice should not be taken lightly because the consequences can be severe and life-threatening. The following are possible consequences: stroke, heart attack, shock, kidney failure. These consequences can lead to a dangerous fall or a car accident if it happens while you're driving. If low diastolic blood pressure becomes a problem, a doctor may recommend some of the following treatments: a low blood pressure diet, where they may want you to consume more salt, an increase in fluids, medication, paying more attention to body positions and movements, avoiding excess alcohol, which can cause dehydration, and monitoring your blood pressure at home. If you want to see the home monitors I recommend, visit my blog post by typing the following into your computer: bloodpressureexplained.com/monitors, or click the link down below. If you found any value in this video, click the thumbs up. Stay healthy, and I wish you and your loved ones the very best.